Hello and welcome to my presentation as World Health Organization Director General. This is a presentation of my response to the COVID-19 pandemic. Here's the table of contents with the main points being overview of the World Health Organization, responsibilities of the WHO Director General, WHO Director General response to the COVID-19 pandemic, Director General role in long-term response methods to the COVID-19 pandemic, and references. An overview of the World Health Organization. The WHO Constitution was created in 1948 to coordinate health within the United Nations system. It includes 194 member states working out of 150 offices. The WHO has around 7,000 to 8,000 workers. Member states part of the WHO come together in assemblies to determine its policies. Its headquarters are in Geneva, Switzerland. The goal of the WHO is to achieve better health for everyone, everywhere. Its main areas of work globally aim to combat communicable and non-communicable disease, provide health through the life course, provide health surveillance and response. The WHO also partners with countries, organizations, civil society to collaborate health work. They also work with non-state actors, research institutions, etc. General program of work handles the organization's finances. WHO regions and responsibilities. Here in this picture, you can see the WHO's 6 regions. You can also see a brief WHO history and certain responsibilities they have and who they operate with. The responsibilities of the WHO Director General. Under normal circumstances, I would be the Chief Technical and Administrative Advisor and Overseer of International Health Work organizational policies. I would also establish core functions and ensure their implementation. Core functions commonly include providing leadership of critical health matters, shaping research agenda, presenting ethical policy options, monitoring and assessing health trends. These core functions can also be applied to emergency situations. In emergencies, additionally, I would furnish appropriate technical assistance and necessary aid upon the request or acceptance of governments, take steps to combat epidemics and pandemics, organize health relief among various organizations. And with this, I must note that the WHO does not provide long-term relief to nations, but it facilitates cooperation between those who can. It also works closely with the League of Red Cross Societies to request medical supplies, etc. In emergencies, I would also inform regional directors of headquarter operations. Additionally, regional directors inform the Director General of received aid so complementary services can be given and services are not duplicated. WHO Director General response to the COVID-19 pandemic. Director General COVID-19 pandemic initial response. International health regulations give the Director General power and authority to declare a public health emergency of international concern. I would likely declare this when reports started showing international spread. This would be shortly before reports detailed that there were 9,976 cases in at least 21 countries. It would also likely be declared after determination of person-to-person transmission. I would also convene with a committee of outside experts to establish temporary recommendations for governments. Recommendations are very important to reduce international spread, but still allow trade to continue. Experts I would meet with would include district, chief, and animal medical officers, along with the Ministry of Health and prime ministers. Meeting with all of these experts allows for a comprehensive view on the issue and takes a One Health approach. I would also designate a global pandemic phase. Pandemic phases. Phases, as you can see, range from 1 to 6 with post-peak and post-pandemic. Phases 1 through 3 would mean predominantly animal infections, few human infections. Phase 4 means sustained human-to-human contact. Phases 5 to 6/pandemic mean widespread human infection. Post-peak means possibility of recurrent events. Post-pandemic means disease activity at seasonal levels. The WHO originally created this for the influenza, but it is applicable to the COVID-19 pandemic. Given that the pandemic is widespread with 6.75 million cases as of June, this would likely put the globe in phases 5 to 6. Different states and regions would also have individual phases based on transmission rates. Vaccine production and distribution. I would assist in identifying a proper COVID-19 strain and begin vaccine creation measures. Mainly, I would expedite the process of review, selection, development, and distribution of vaccine viruses for pandemic vaccine production. I would also consult with the International Federation of Pharmaceutical Manufacturers and Associations and the Developing Country Vaccine Manufacturers Network about production recommendations. I would also collaborate with partners to create and distribute vaccines to countries who cannot facilitate this themselves. This involves shaping the research agenda, as mentioned before, as one of my roles. It also involves my role in creating policy measures for expediting the process. Providing an assessment of pandemic severity on health. The WHO Director General will collaborate with others to perform this assessment and communicate it with governments. This would help governments determine the level of response required on their end. It would also help with deciding on mitigation measures, medication and treatment use prioritizing, managing community health care, and communication with the media and public. I would also update severity assessments over time. It is important that to do this assessment, each country and government has its own surveillance systems for monitoring and early detection investigations. I would caution that assessments done at the global level may not directly apply at the national level. Indicators of severity for the assessment include case fatality rate, unusually severe morbidity, unexpected mortality patterns, and unusual complications. It is important to note that these are only based on observed health effects. Director General role in long-term response methods to the COVID-19 pandemic. Monitoring and assessing health trends. Investigate the health effects of new strains and determining where globally the new strains are occurring. I would also ensure that individual states, countries, and territories also have their own monitoring and surveillance methods. I would also assist in creating guides and toolkits for countries to use as guidance in their surveillance methods. I would also provide global health statistics after the assessments are completed. This is a collaborative effort, and these would be operations that I would likely oversee. I would ensure country reporting compliance. International health regulations are legally binding for 194 states. They provide a legal framework to prevent, control, or respond to public health risks that may spread between countries. IHR requires states to individually have the capacity to detect, access, and respond to disease events. This includes surveillance. It also requires states to inform WHO of new cases and events with detailed information. Verification of reported cases may also be sought. I could also request to obtain information from incoming aircraft, ships, and other vehicles and travelers. Global communication and updates. Communication and updates would be continuous within my role. The Director General acts as the face of WHO communications in many situations. This is extremely important to keep people on the same page and prevent panic. It would also ensure all new information that people have is up to date. Here are the references used within my presentation. Thank you for watching.